Hello and welcome to the August edition of the LLR LMC podcast, covering what's in our monthly newsletter. July and August have always traditionally been very quiet months, but actually, as you can see from this month's newsletter, which again is extremely long, which I apologise for, the MC has got much going on at present. So I'm going to take you through the most pertinent parts of the newsletter. I can't cover all of it. I did try and cover all of it last month, and the podcast got to now, so I'm not doing that again. So I'll just take you through the most pertinent bits. So we'll kick off with the LMC is launching 3 new services. The first is regarding TPP Automate, which is a system which will automatically file away normal results which come down through PathLink. The problem with this system is that every practice has to tailor it to the local lab, the local lab's reference ranges, and the way that they express results. Now, we think that from the MC point of view, we think that's a sort of disproportionate task in practice to do that. And so what we're doing is that we are actually going to fund one GP within LLR who's going to provide a service where if you sign up to it, you will get an easy to follow guide how to set it up, but also pre-developed templates. And then in the future, if the lab changes a reference range, adds a new result, or makes other changes, instead of every practice having to do that independently, separately, this will be done by that one person, and we will then pass it around to all the practices that have subscribed to the service. Now, this is completely free. We're doing this from the LLC levy, so it's at no additional cost to practices. So if you'd like to avail yourselves of the service, which will save an awful lot of admin and clinical time, then please contact the LMC on the usual email address, which is inquiries@llrlmc.co.uk. The second new service is mediation. So 5 board members have now been trained and accredited in line with the Civil Mediation Council. We are now able to offer this service. This will help for practices where there's a dispute between partners and practice managers, between practice managers and staff, between partners and staff, partners and salary GPs, you name it. If you think that we can help, particularly if we can help to stop a problem escalating, then do again contact the office and we can provide that service for you. The third new service that I've got to let you know about today, to announce today, is regarding safeguarding administrative leads group. Now, every practice has been encouraged to have an admin lead for safeguarding within practice to support the clinical lead. Now, what was noticed by Eric Rastogi, who is not only one of our board members, but is also the safeguarding lead for the ICB, is that this group are a bit isolated and don't feel supported. So with his help, the MC is supporting a group where the admin leads can discuss with peers about sort of issues and problems, and where we can provide information for them. As part of this, there is a WhatsApp group, which again is also voluntary if your admin lead wants to join, but we're hoping that will again help peer support and learning. So please talk to your admin lead about it, and if they want to themselves of the service, please just let the office know. Moving swiftly on, 10-year plan. This is going to be a standing item each month. This month there isn't much to say. I put a little bit about it in the newsletter, but I think people are still trying to get their heads around what the ask is and what the possible outcomes are going to be. So more in following months. There is a lot of concern about it, as I put in the last newsletter. There is a particular risk to general practice, and the BMA was also concerned, and there is going to be a special representative meeting later this month to discuss this issue. the SRMs are formed from the same membership of the annual general meetings of the BMA. So as you kindly elected me to be a member of the representative body for that, I will also be attending to represent Leicestershire and Rutland doctors at the special representative meeting. So please let me know if there's anything particular that you want me to raise or you feel that needs to be discussed. Next, within one of the GP Info weekly newsletters, it stated that GPs had to have a back office number. This, of course, is inappropriate and it's not a requirement of general practice, although it would be helpful for many different groups. The LMC has been working with the ICB on looking for solutions like this, particularly ones which aren't going to cost the general practice, not least because the ICB say they haven't got any money to fund or support any ongoing service like this. Now, the ICB believe that they have found a solution which is available through the web-based telephony, which can be provided at no cost and no hassle to practices, and they're calling this a dial 9 for a clinician. I think it's quite snappy for the ICB. I quite like that. There will be guidance coming out to help practices set that up. But basically what it means that if one of the trusted partners who've got access to this want to cut through the queue, once contact with your switchboard, they'll basically fly an additional 9 and that will take them through to the head of the queue to be answered next. Please let us know if that gets abused and we can always try and sort that out, but we think that is going to be beneficial. As I say, news that coming out soon. Contract changes, there's quite a few changes coming up from the 1st of October. You may have picked up that there's a particular issue regarding what was in the written offer to general practice and what's in the wording of the change to the contract, particularly requiring practices to have their doors open throughout the whole of the core hours. This has never been a requirement before, and it's always been up to the practice to have that flexibility whether they wish to open or not. And of course, it will depend upon a lot on your demography as well, whether patients need it. But there's no caveats with it. There's no, if appropriate or where capacity allows. I personally, and a lot of LMCs are saying that this is totally wrong. So we have raised with GPC England to go back to NHS England to say that we feel this oversteps what was agreed with the profession and needs to be sorted out. There is actually an upcoming conference of LMCs within England in November, and one motion that the LMC is going to put forward is one on this topic. We've got many others that we're also putting forward, but if there is an issue that you believe should be raised to put onto the policy agenda for GPC England, then please contact us and let us know. If we haven't got a motion already covering it, then I'm more than happy to raise it, but that's got to be done before the 8th of September 2025. Moving swiftly on, treatment of dental problems. Now, this is an issue that comes up time and time again to MC offices for as long as I can remember. Under the Dental Act 1984, it is unlawful for anyone other than a dentist to practice dentistry. Now, there's a small caveat in that it says that a registered professional, medical professional, i.e. if you're registered with GMC, you can provide dental care if you are trained to do so. But I suspect most people like me are not trained to do it. So treating an abscess with antibiotics is often, not always, a wrong thing to do. Abscesses need to be treated by drainage or sorting out the problem with that tooth. And just treating by antibiotics can be harmful to the patient, who might then go on to develop sepsis or other problems. Under the Dentist Act, if you do practice dentistry out with the legislation, then you are liable to a fine. Please make sure that all of your clinicians are aware that treating dental problems, it isn't, we're saying, it's not just because we're not trained to do it, but it's unlawful for us to provide that service. So please let everyone know. If you want the details to be able to quote, it's all in the newsletter. And next, Mount Jara to Severtide, the rollout of a system for providing this on NHS to patients for obesity and weight loss has been put back ahead. Again, the ICB are now saying probably not until the end of 2025, so the end of this year. Of course, remember that this is supposed to be put in place by 23rd of June 2025. And it's a bit laughable that they have a real go at us and fine us, so basically we're a bit late with claims and things, but they feel it's appropriate to run this far over their own deadlines, but never mind. But initially they were talking about having a tier 3 hospital service do the initial assessment, but they're now thinking about asking general practice to do a whole lot. They haven't been through the spec with them nor the costings with them yet, but once we are happy with those, then we will put them out to be looked at by practices for you to decide what to do with them. Obviously, it's going to be very small numbers. You'll be given a quota of how many you can do. They will be checking out that patients to meet the very strict criteria, which is basically the BMI more than 40, 37.5 in certain ethnic groups, and having at least 4 of the recognised comorbidities. Next one, training and development. Now, I think this is a car crash. I think I'm absolutely appalled that in its penny pinching mood that the ICB has looked to stopping all funding for GPs and staff and their staff. I think that is so short-sighted. We have formally written to the ICB, we have met with the ICB, but they have made the decision and they are not going to waver from it. I'm particularly annoyed because in 2004, when the new contracts came in, there was money that had been flowed via the SFA, the Red Book, to practice to GPs, which wasn't mapped across into the global sum or any other service, and was left up to local discretion. Now, locally, it was agreed that that money could be used for training for all general practice staff. And regardless of how long ago that is in the past, I think if an agreement is an agreement, you should keep to it. And again, so what does it mean, when we in future agree other things with the ICB? Does it mean that they feel free to then sort of change their minds at a whim, or if things getting tight for them? I just don't think it's appropriate. Next, regarding premises and estates, just to say that there are 3 funding streams available at the moment. There's a business as usual fund, which is a very small amount of money that the ICB receive on a yearly basis to spend on GP practice premises, from which there's only enough to do with some 1 or 2 schemes a year. There's the utilisation and modernisation fund. We've had 1 year of a 5-year scheme. The first year's only been for practices where they can provide more clinical space by internal reconfiguration, but we're hoping that's going to be more flexible in the future and for over the next 4 years. And then finally, there is this Section 106 of the Internal Country Planning Act, or SIL monies. SIL is only being used in rugby, so that if there is a planned development close to your practice, which is going to affect you by increasing your patients, then please contact the ICB as soon as you can, or as soon as you are aware, so you can talk to the premises group and estates team about putting together a bid. The premises and estates team are willing to talk to practices at any stage, so even if there isn't a particular scheme that you're thinking about, if there is just that you know that you've got a need and you want to talk about how to put together a bid, what information is needed, what sort of preparation work you need to do, then contact them. They're more than happy to talk to you in advance and more than happy to help you to put together a bid. which is more likely to succeed. Often within the NHS, we get pots of money released at the end of the year, saying, you know, is there anyone who can actually use this money? If we've got a sort of a flow of schemes ready to roll, then we are, as a system, more able to utilise that funding. So please, if you're thinking about it, if you've got a need, talk to the Premises Estates team. The contact details within the newsletter, as well as who they are, and talk to them, and they will help you to do that. And then the final thing I want to talk about is about the Joy app. Now, there's been a concerns raised about this app in that it's only for the the contact management service, and not the other sort of Joy product. So it's just that one service, the Joy CMS, which enables a person not working in the practice, so a social prescriber, to write back into the record of what they've been doing. Now, what happens at the moment is the way that it's expressed within the record, it looks like it's been entered by someone within the practice, which of course is erroneous and interferes with data integrity. And although this is just one, there's going to be a growing number of services with write-back facilities into the GP record. So we need to make sure these principles are got right from the beginning. Now, I've had conversations with ICB, I've had conversations with Joy, and it does appear that the problem stems, believe it or not, due to the way that TPP has developed System 1. So we'll continue to talk to them about how this can be sorted out, or whether there's a workaround that will enable the right information to be displayed. Particularly, we are concerned because as more and more patients are accessing their own records, of course, they're going to see this entry. They can assume if it's got the GP's name in it, that GP actually put the information that actually knows all about it. Of course, they don't, which could lead to confusion by patients. It could lead to increased admin workload by the practice, and possibly even complaints, and possibly even although low risk being named in some sort of joint claim action if something has gone wrong due to that particular advice support that was given. So as soon as we've got a solution on that, we will let you know. In the interim, the ICB is suspending the Joy CMS advisors of that until it is sorted. So that's the end of the main parts of the newsletter. Just to sort of point out that we do have a list of additional webinars that we're putting on and other meetings. So at the moment, we've got for the 9th of September, we have a webinar regarding, and I've forgotten, I'm just going to have to look it up. This is rather bad, isn't it? Because I've forgotten what it's about. So we have a webinar on the 9th of September regarding succession planning and partnership change, which is being done by Rebecca Reynard from GP Surveyors, and I hope that'll be useful. And we've also then got on the 6th of September, so this is for city practice only, introduction to the change in contract for NHS health checks. Local authorities have got to change their contracts for this in line with new procurement regulations. They've been working closely with the LMC to try and make it as painless as we can. I cannot make it completely painless because it's a bureaucratic system, but Gary Arnold from the LCC and his team will be there to introduce you to what the change is. And they also are running for 3 weeks drop-in sessions where you can just drop in and ask them to help you to complete the paperwork. If you are interested, contact the LMC office to book a slot for that. On the 9th of September, we've got a session on what the GP needs to know about their pension, being run by Chase DeVere. And then on the 18th of November, we've got an additional date for understanding practice accounts and income sources for general practices. Now, for the first date of this, didn't even get to the newsletter because we advertised it between newsletters, and within 2 days it'd be completely booked out. So we run the additional session. It's been run by Glyn Rawlings, who hopefully you all know. I've known him for many years, for I think at least 20 years, when he was a practice manager in a general practice in Nuneaton, so he's an extremely experienced person, and he's also worked with accountancy companies, and so he knows what he's talking about, and is well worth coming along and listening to that. We are always looking for new topics, so if there's anything else that you think that the LMC could help you with, then do let us know. And just to also let you know that we are listening within the newsletter podcasts as they develop, but also this time we have put recordings of 2 webinars, so that if you didn't actually, if you're unable to attend, we've now put the full recording for you to watch them. The first one is on the Understanding National Rent Reviews and Improving Property webinar, and the second one was a webinar with the solicitors about partnership agreements and what you need to know. So if there are topics that interest you and you're unable to get to the meetings, then please watch them. There's links within the newsletter. Okay, so that just leaves me to say farewell for this month, and just stay safe out there, and any problems that the LMC can help you with, just let us know. Okay, so I'll see you next month, which will be the first one we'll do.